Now, May is Better Hearing Month. It also happens to be Mental Health Awareness Month. When it comes to hearing loss, there's an important connection between hearing and your brain. To cover that and more, Dr. Haley Owen, an audiologist at Livingston Hearing Aid Center, now here to talk more about that link between the two. Dr. Owen, thanks for coming in.
Thanks for having me.
Absolutely. Let's jump right in. First, how are hearing loss and mental health even connected?
People with untreated hearing loss are more susceptible to experiencing mental health concerns. This includes loneliness, isolation, cognitive decline, and even dementia. Research indicates that seniors with untreated hearing loss experience cognitive decline up to 40% faster than others. Because hearing loss happens gradually, people slowly lose touch with others around them, conversations, and leads to mental health concerns without them even realizing it.
Wow. And so how is untreated hearing loss now tied to that loneliness and isolation? You just touched on it.
People with hearing loss are often left out of conversations. This leads to feelings of isolation. It's like listening to a conversation in another language and not being able to interpret what's being said. People eventually self-isolate because it's too much work to listen. If we can treat the hearing loss sooner, it's possible we could solve some of these mental health concerns before they happen.
Of course. And so why are people at increased risk for developing dementia if they don't treat that hearing loss?
Yeah, so mostly it's due to the lack of auditory stimulation. So if that auditory information doesn't get up to the brain doesn't process it, leading to that cognitive decline. One study shows that people are actually 24% more likely to experience cognitive decline with untreated hearing loss than those who have treated their hearing loss.
That's incredible. And do patients often talk about that mental health concern at appointments? I'd imagine it's something that they don't bring up.
You know, most patients that I see at Livingston, they talk more about feeling inadequate or, feeling more like a burden. I've had patients tell me that they feel uneducated, because their hearing loss makes it feel like they, are missing out on a lot. They're a burden to their family. I mean, this can't be mentally healthy to feel like a burden all the time.
Oh, absolutely. And so how can family members then help loved ones who are hesitant about getting help with their hearing loss?
Gentle support is key. You might start the conversation by just talking about what you notice. Hey, Mom, I've noticed that you're turning the television up more. You're asking people to repeat more often. Go with them to their appointment to show support.
Excellent, Doctor. Is there anything else you wanted to touch on?
At Livingston Audiologists and hearing healthcare providers, we can answer any questions that you might have when you come to your appointment, and talk to your audiologist about your concerns. If you're having feelings of, isolation or loneliness, bring these up. If you have a family member with you, it might help them to understand what you're going through.
Excellent. A lot of good information right there. Dr. Owen, thanks for coming in.
Thank you.